Hi everyone, my name is Dr. Jennifer Jackson. I'm a registered nurse, and this is a presentation on ethical and sensitive issues in healthcare research. So I'm going to be talking about the concept of ethics in research, specifically in nursing research. And so what those different concepts look like. I'm going to be talking about bad examples of research and how the legacy of bad research informs what we do today. And then I'm going to be talking about how we can do ethical research in our modern context. So these topics are a bit intense, so I've split them up into different videos. So if you're seeing this on YouTube, there'll be three different videos covering this topic. And if you're in my class, you'll see that I've presented those, so please go through them all. But we're going to start with ethics as a concept. And so what does that mean when we talk about ethics in research? Because we can have ethics in clinical practice, we can have ethics in, our professionalism. There can be ethics in lots of different things that we do in healthcare. So what does it specifically look like to have ethics in research? And what are we talking about when we do that? So I hope that these sessions will help you to understand the concept of ethics and know how to apply different ethical principles. So I will try to give lots of examples so that you appreciate the influence of history on ethics and why we have to think about sensitive issues. And also talk a lot about, ethics might seem like something that kind of floats around in the air, but it's actually very, very concrete. And I can give you some examples as we go through to talk about how this relates very directly to practice. And so then we want to think about, when we have different kinds of studies, how can we make sure that we do have ethical research? Just because things are sensitive doesn't mean we don't study them. But it means that we do have to have extra caution and be very, very careful. So we're going to start off with ethics as a concept. And I think to set the stage for that, it's important to say, why is research in nursing or research in healthcare important anyway? And so this relates to the idea of nursing being a discipline and nursing being a profession. And so the definition of a discipline is a group of people that all draw from an independent body of knowledge. So nursing practice is informed by nursing research. Dietetics practice is informed by dietetics research. And so in clinical practice, our roles can overlap a bit, like dietitians and nurses collaborate together over, the best food and the best strategies for nutrition for our patients. But we come to that discussion drawing on our own specific disciplinary body of knowledge. And without that, we are not distinct disciplines. And so that is extremely important when we're saying, what is the scope of practice of nurses? What is the scope of practice of other professionals? What do nurses do that other people don't? That is where our disciplinary body of knowledge becomes very important. So when we talk about a discipline, it's a group that has their own body of knowledge. So then when we compare that to a profession is a group of people who have several characteristics, including self-regulating and a disciplinary body of knowledge, as well as, probably standards and guidelines that they follow and structures that support practice. So leadership, different types of policies, that type of thing. So for example, engineering is a profession, nursing is a profession. There's lots of different professions, but in order to be a profession, one of the elements you must have is a disciplinary body of knowledge. So nursing research makes nursing both a discipline and contributes to nursing being a profession. Now this matters because if you have people who say, oh, nursing's easy and it should just be an apprenticeship and anybody can learn it and you don't need to go to university. And actually that conversation is still happening in most of the world, including in countries like the UK. So that's where it's important to use your voice and say, actually, nursing has a disciplinary body of knowledge and thus meets some of the criteria for being a profession. And by not educating nurses in universities, we'll lose that professionalization and disciplinary standing. And that's a lot stronger argument, I find, than, no, you're wrong, even if people are wrong. So that's why research matters in the first place. And for this research to be credible and have these roles in our work, the research has to be good quality. And the first threshold of, is the research good quality, is the research ethical? So when we talk about ethics, there's two different definitions here. So ethics is about saying, are our actions right or wrong and good or bad? But it goes far beyond, say, a hospital policy or what is currently polling well or anything more than that. It's that sort of fundamental question of, how through my humanity may I do the right thing for others? And it's important to recognize that ethics kind of supersedes some of these other things, because you know what, like during the Nazi regime in Germany, euthanizing patients that had health problems was hospital policy. So the idea that like hospital policy is enough to safeguard ethics is not true, because we've seen there's lots of historical legacies where it hasn't been sufficient. So ethics goes above and beyond any kind of written documents we have to follow. And it's important to consider how we can justify our actions and what values we bring to that work. So just like clinical practice, ethics is something that feeds into all of research. So it's woven into every element. It's not just something you do at the beginning, or it's not just something you do through approvals. It's in every aspect of the process. And in reality, it is very complicated and difficult to navigate. So that it may be hard to fully appreciate that when you're first learning about it, but it is very, very difficult, because as a researcher, you have the responsibility at all times to make sure the research is ethical. And so if something happens, you have to deal with it. And in my experience, all kinds of things happen that you never could anticipate, but you still have to try and handle those situations. And so, you end up with things that are just, just that you really did not anticipate. So, for example, an issue I had in my PhD research is that I recruited people via Twitter. And one of the core elements of research ethics is that you protect the identity of the people who participate. So you don't disclose who is part of your research. And then a person who I had interviewed went on Twitter and posted their Twitter handle and my Twitter handle and said that they had been part of the research and it was great and other people should join the research too. So I have a responsibility to protect the identity of my participant, but my participant has shared their own identity and associated them with the study. So what do you do? Because that person has autonomy, they can consent, they were able to make their own decisions about sharing information or not, and they had the free right to choose to do that. However, it's my job to protect the participants, and does this violate that right to privacy in research participation? So in the end, I contacted the individual and I said, you know what, you have every right to post whatever you want on Twitter. It's fine to disclose that you're part of the study, but just be aware that if somehow someone gets my thesis and associates it with you, I cannot guarantee that there would not be negative consequences for that. Now, the research wasn't particularly controversial. So it's likely that nothing bad would have happened, but all the same, like that is an ethical breach in what I'm doing. So in the end, that participant decided to delete the tweet and, just posted something kind of generically supporting nursing research. But that was something that, I had no anticipation that an individual would disclose their identity. I had all kinds of protections in place so that I wouldn't, but it was difficult to say, like, what is the correct approach here? And even that example is an issue that's not particularly emotionally loaded either. And you can get into a lot more complicated things as your topic unfolds. So you also have to live in this area of uncertainty. You're kind of in the gray. There's no black and white answers here, and that can be really uncomfortable sometimes. So there's no right or wrong. And with ethics, you need to be able to say, okay, how do we get the most good or the most right, or what is acceptable for the people that we're working with, whether it's patient or family, and how do we try and get as much ethically aligned as possible so that we don't end up with moral distress or things like that. So this is a whole complicated area, but I'm going to go through some of the main concepts that apply to research. And so when you see these terms, you know what types of ethical ideas or concepts they're referring to. So the main ones are consequentialism or utilitarianism and deontology. So those are huge academic philosophy words, but it's important to consider that these are actually extremely relevant in day-to-day work. So when we think about consequentialism and utilitarianism from Bentham and John Stuart Mill, these ideas are that whether something is good or bad is justified by the end outcome. So as I've got here, the end justifies the means. That is the sort of condensed, perhaps oversimplified definition of consequentialism, is the end justifies the means. However, from Immanuel Kant with deontology, we have that the morality of an act is based on whether the whole of that act complies morally, or whether parts of it do not. So it's less about what outcome you get at the end, and it's more about the journey is more important than the destination. And so it's not that one is right and one is wrong. It's just that they have different roles in different contexts. For example, in doing blood work, on someone, so drawing a couple tubes of blood, something that nurses and phlebotomists do every single day. Statistically, in the UK, 2 to 3 people die per year because of that procedure. So whether it's the procedure's not done properly, whether it's they get group A strep infections as a result of the skin being pierced, there's all kinds of things like that. So technically, there is a risk of death from drawing blood. However, if we were to have a utilitarian perspective on that, we could say, you know what, the likelihood of that happening is so small. And by drawing these blood samples, we can potentially look at new treatments for leukemia, and that could save thousands of people's lives. Then in that case, you're probably going to have a consequentialist approach to say, you know what, the ends justify the means here. There may be a risk in drawing blood, but the overall potential net benefit is greater than the potential harm that could be done. So that's a view of what consequentialism looks like, as the end justifies the means. However, if we have a different perspective, it might be that deontology is more important, or more appropriate, I guess, in terms of how we want to think about a situation. So for example, we could be trialing a new cancer drug, and we could be supporting patients that are receiving this cancer drug. And maybe, their tumors are shrinking, and, we're getting good response from, the cancer cells are dying because of this new drug. but maybe this new drug is creating huge amounts of fatigue, excessive nausea, people can't even keep food down, they can hardly get out of bed in the morning, and you know what, they just feel like awful symptoms every waking moment. So in that case, it might be a question of, yes, this new drug that we're testing is making their cancer shrink, but it's also so unbearable that it's not worth ruining someone's life to try and get maybe a small amount of benefit, when perhaps the current options are a lot easier to have in terms of the lifestyle consequences. So that's an example of where you may take a deontological perspective and say, you know what, it's not worth putting somebody through this to try and get a little bit of benefit. And we need to think about the journey of what is this person with cancer experiencing, rather than, well, we got, you know, a 3% reduction in the tumor size. So I hope those examples show that there's sometimes where like one perspective might be more important, and another perspective, and another time another perspective might be more prominent. And one's not right and one's not wrong, but you have to know when you're making decisions, which angle am I coming from and how is that informing the decision making that I'm doing here. And also we have some key ethical principles here. You may have heard these words in other contexts, but I'm just going to talk about the idea of how they apply to research. So when we think about beneficence, it's the idea of like we have to do good, or we have to convey benefit in what we are doing. So in research, we don't do research just for the hell of it. We need to make sure that the research we're doing has a purpose that could convey good. And so I heard this explained to me once, and like, don't at me for the language of this, but I think it's very memorable. And so you may see that like the idea of, I had a researcher tell me we all love nut sluts and perverts. However, that's not, voyeurism is not a good enough reason to do research. So I think that applies here because, you know, we see all kinds of like very popular right now is true crime documentaries and things. And underlying a lot of those, the question is like, what is wrong with this person? How could they do something so crazy? But actually, if we're asking those questions, but it's not really conveying benefit, then it's not necessarily ethical. So we could say like, what is the psychology of someone who has committed murder, and how can we use that to rehabilitate, or how can we use that to provide mental health support? That's a worthy question. But just saying what's so wrong or so screwed up with this person that they would do this action, that's not helpful. That does not create benefit. And so that would violate the idea of beneficence. So also we think about the principle of protecting participants. So non-maleficence. So do no harm. And this is something that we have to consider, like, does the harm, potential harm, outweigh the potential benefit? So this might be an example, like we talked about with the phlebotomy or the studies that involve taking blood samples, that there is a small risk of harm, and there's no research that is completely free of the risk of harm. It can't be done. So there are studies that have very, very low risks of harm, but what we want to do is make sure that what we're doing has the lowest risk of harm possible. There are different studies where, you know, you're going to do something that is potentially upsetting or potentially a little bit painful, but how are you going to protect those participants and make sure that your research is not harming the people who are involved? So autonomy is the right to informed consent and self-determination, and everybody who's participating in research being treated with dignity and respect. This is extremely important, particularly in the context of the next section of this talk, because when we've had bad research, and there has been a lot of it, Often it's the right of autonomy that has been violated. So sometimes we have research where we sort of disguise our true purpose because we want to see how people react like in the real world. But we have to make sure that, you know, after the study is over, they are informed about what happened and that they consent to participating. And we have to make sure people have all the information about the research, about their rights to withdraw, and that they are protected and respected at all times. Finally, we want to think about justice and the right to privacy, confidentiality. Like I was saying earlier, we have to protect the identity of the participants, particularly when you get to studies that are maybe more controversial or more sensitive. You also have to have the right to fair treatment. So this might mean making sure that your research is equitable and that, you know, people of all genders, people of all racial groups are included to make sure that what you're examining is appropriate for, you know, our societal groups of people, not for the exclusive benefit of, say, white males. So all of these principles come together, and some in different prominence than others, but they all have to be considered when you're doing a research study. And so I'm going to unpack them a little in more detail in the subsequent videos, but this is an overview of ethics as a concept, and now we're going to talk about how it can be applied.